Today class we are going to discuss the most important topic in unit 4, that is basal skin resistance, BSR. The learning objective of this today class is that first we will be discussing what is mean by BSR, the fundamental concept of BSR. Then we will be discussing the working principle of BSR and the technical factors which is need to be considered while we are measuring BSR assessment. And then finally we will be discussing the different clinical application where the BSR is predominantly used, especially in the field like medicine, psychology, and biofeedback therapy. So let us begin with the basic introduction, that is a definition of BSR, basal skin resistance. So the basal skin resistance, which is nothing but it's a clinical resistance of skin tissue when we are measuring under resting condition. So it clearly gives the information about what is our sweat gland activation. So whenever the sweat gland is getting activated, so based on that our skin resistance property will change. So the measurement of this skin electrical properties, which is nothing but BSR. So this BSR will give you the information, or it will give you the status about the system called autonomic nervous system activity. This is very very important activity. So let me tell you in simple word what is mean by autonomic nervous system activity, because the BSR is playing very important role to assess the functionality of this particular system. So the autonomic nervous system activity, which is nothing but it's an involuntary body activity or body movement which is take place in our body. For example, our heart rate, our blood pressure, our stress level, even our pupil response. So these are the functionality of autonomic nervous system. So basically, the autonomic nervous system found in two types. One is sympathetic activity, another one is the parasympathetic activity. The sympathetic activity, it goes everything in higher end, that is high heart rate, high blood pressure, and then a high stress level and so on. Whereas the parasympathetic is just opposite. It slows down the all the process, like slow heart rate, low BP level, and low stress level. So this sympathetic and parasympathetic goes hand in hand in order to have a normal balanced condition of our physiological changes. So if there is anything goes wrong in this process, in this sympathetic or parasympathetic process, there comes the abnormal condition, or you can have a hidden so many diseases. So that is the reason the BSR found as one of the non-invasive method. It's a technique to assess the physiological changes by means of assessing the sweat gland activation to assess that, to reflect the autonomic nervous system activity. So now we will see the user perspective of this particular BSR. So what actually the BSR, how does it evolve, what are the different opinion has been shared before developing this BSR. So there are a few peoples, peer members like patients, clinical clinicians, and the researchers. They were discussed among themselves, and they have shared their perspective about this BSR, because the people generally need one such device to have monitoring their physiological changes, or to measure their stress and arousal levels, to have their body condition to be monitored properly. Even clinicians or the physicians, if you see, they also need some non-invasive biomarkers. For example, here the BSR, they have taken electrical property of the skin. So because based on this, they can even have some sort of clinical procedures or a treatment procedures or treatment decisions. So these are the things that they have been discussed before developing this BSR. So finally they have come up with one problem statement. They have strong desire to develop, or there is a need of a simple reliable non-invasive method to assess this autonomic nervous system activity and emotional arousals, in order to have a accurate diagnosis, effective therapy, and continuous monitoring. So here comes the solution, that is the BSR, that is the basal skin resistant. This is a one kind of non-invasive method to assess the autonomic nervous system, where the electrical changes based on the sweat gland activation of physiological changes will be measured, and based on that we can have so many analysis and so many treatment will be given accordingly. So and also these BSR it's good enough to give a very good measurement in terms of accuracy, and also it's a user friendly, and it can be operated by any sort of people, even patients or even physicians. We know there is no need of any trained people to operate such a device, and it also have a provision to integrate with any sort of devices to have a seamless workflow of treatment. And also we have a easy data interpretation provision to have a meaningful or clinical decision making. So these are the like empathy perspective which is being collected in order to develop the BSR. And once the problem is clearly defined, the solution has been brought out as a picture of basal skin resistance setup. So next, we will move on to the what is the physiological mechanism of this BSR? How does this skin, sweat gland activations, which in turn change the resistance electrical properties of the skin. So once when the people exposed to any sort of stimulus or emotional changes, immediately the brain will send the signals to autonomic nervous system. Through this sympathetic response, it will triggers the physiological changes. One such physiological changes, which is nothing but sweat gland activity. This sweat gland activity will increase the secretion, which in turn change the electrical properties of skins. So when the sweat increases, automatically the conductance property of the skin also increases. Thereby the resistance changes will occur. So in this way, the change in resistance will directly map with the physiological changes happening in the body. That is the emotional changes related to the stimulus which are happening in response to what we are exposing. So far, next we will move on to the instrumentation aspect. So if you take any BSR device, there are only one or two few components or which are being involved in this setup. First one is electrodes. That is the main component which is have direct contact with the skin, where you want to measure the skin resistance. And then we have amplifiers, because once the signal is being tapped from the electrode, that need to be amplifier, that is strengthened to particular extent, to the some extent, to be further processed. And then we have recording system, and they have some sort of signal conditioning block also, to in order to remove some artifacts, or need if there is need of any filtering process. So the main working principle, that is measurement principle which is involved in BSR, is that simple Ohm's law. Either you can go with the constant voltage method or constant current method. So you know the Ohm's law, V is equal to IR, right? So here the change in resistance, that which is nothing but your skin is the unknown resistance that you need to be measured. So to the skin, if you are passing, if you are applying the constant current, that is a known value, then based on the changes in the skin resistance, the voltage drop across the skin will happen if you are measuring that voltage, which is directly proportional to your change in resistance. So in this way we will be measured your BSR here. So either it can go with the constant voltage method or the constant current method. In constant voltage method, we will be applying fixed voltage, and then current variation will be measured in accordance with the change in resistance. Similarly, for constant current method, we will applying the constant current, and the voltage changes here happening based on the change in resistance. So these are the two methods which is being employed in case of BSR measurement. And there is one more component, that is called GSR. Because the BSR is a basal skin resistance, when we are measuring a resting condition, once we are exposed to some sort of stimulus or the external factors, the body will have some changes, the physiological changes will happen in the body. That measurement of resistance is nothing but GSR. So GSR is the galvanic skin response. So that is a skin response that which end up with some sort of stimulus. So that is the main difference between GSR and BSR. So both will happen in same electronic setup. So by using either constant voltage method or the constant current method. Next, we will have the clinical application, or as already we discussed, this BSR it's been used in variety in a wide application. So first we will have medical diagnostic, because it gives a clear picture of what is the autonomic nervous system activity. It will clearly picture out, or clearly reflects the if there is any disinfections happening in in this nervous system, which will give you the hidden disease or a disorder happen at early stage. And also in second application is like psychological research. So same BSR we can be used to assess the mental health status or mental health uh, problems. So that also we can do it. And finally we have a biofeedback therapy, that also one kind of clinical application, where we can have a real-time monitoring for a treatment, or for you can have any training process. So based on this feedback, we can also manage our problems, or we can manage our stress, or we can manage our health related problems. So which highly helps patients to have a self regulation techniques also. So these are the major three wild clinical applications. And also we have so many factors that need to be considered before doing this sort of assessment, because we are measuring what real time data, right? That is the real time temperature variation, I mean real time skin resistant variations we are measuring. So we have to be so many things put in right proportion or right optimum condition. One such is environmental factors and subject preparation, and finally the output what we are getting, that need to be check in the aspect of quality. So and then future direction on scope of this particular BSR topic is that wide, because since it is a non-invasive handy device, even we can incorporate it in wearable electronics or wearables, to like use for stress monitoring device, and you can have a real-time health assessment. And also we can use for personalized biofeedback for the patient to have a self regulating their health conditions. So these are the future direction. And here I have given a few assessment related to this topic. Later you can check it out. And I have included one student activity that we will use to conduct in during class hours. So finally, summary of this today topic is that today we discussed what is mean by BSR. So in BSR, first we covered the basic concept and nature of the BSR. How does it work? What is the definition? And then finally we move on to the physiological mechanism, that is a working principle of the BSR. How this basal skin resistance is getting vary when sweat gland get activated. How it has been related with the autonomic nervous system. And also we have a discussion of instrumentation point of view, that is where what are the different components which is being involved in BSR measurements that we discussed. And finally we discussed what are two different methods where we can use for measurement of BSR. One is constant voltage method, another one is constant current method. And finally we wind up with the applications. Majorly it's cover three area. One is medical psychology, and last one is biofeedback therapy. So that's all about today topic. So these are the few reference that I have referred for this particular topic, for your kind reference. Thank you.